Campaign Watch 2012 with Ches Costanzo.
Americans are being forced out of the endless resource ether, and nowhere is the public going to feel that more than in the delivery of medical services, especially end-of-life Medicare services. Of particular interest to us is how the presidential candidates are going to approach this very touchy subject. Today, we peek into the thought of two highly influential conservatives at the Hoover Institute. First, Newt Gingrich, presidential hopeful, an opponent of Obamacare and the death panels that he felt it brought on. And then we're going to look at Richard Epstein, influential libertarian writer, highly regarded fellow at the Hoover Institute as well. First, Newt Gingrich. Newt, tell us how it's going to be at the end of our lives.
At Gunderson Lutheran, and my father-in-law died of lung cancer there, and we personally experienced this. At Gunderson Lutheran, the doctor engages with the family in a genuine discussion about the appropriate steps as part of the end-of-life process. There is no budget pressure. There is no external reporting. There are no standards set by the government. There is no fear of a bureaucracy. It's an honest conversation with people who understand that they're in a difficult situation. When an advance directive is written, and about 92% of their patients end up with an advance directive, it's in an electronic health record, so every member of the staff knows what the advance directive is. So they can deal with the patient and the patient's family in a knowledgeable way, exactly as the family requested. They also have very strong palliative care to deal with pain, and they have a hospice program for people who are really beyond a point where heroic methods would help. The result is they have very high approval.
Newt, I gotta say, that sounds great. Just leave all the decisions between the patient and the doctor, and whatever type of care that they choose with no budget constraint, and somehow all of our Medicare and spiraling Medicare cost problems are solved. Does Newt really believe this? Richard Epstein certainly doesn't. Richard?
What's going to happen, if you want to be honest about it, which I'm quite happy to do since I'm not running for public office, is there will turn out to be some people for whom the cost of insurance is not a cost of insurance, they're known risks. So it's just a question of whether or not the rest of society wants to take somebody who is going to live for 2 more years, and it's going to cost you $1 million in order to do that. And you could put them in an insurance pool and pretend that it's insurance when it's a certainty, right? Or you can say, no, the price is too much. And my view about this is there comes a point in which I'm prepared to say the price is too much, and I don't think myself as heartless. I think myself as saying, look, this is a lousy investment. You're getting basically 1 year for $500,000. If I can take the same money, I'll keep it out of private hands, keep it in public solution, and spend it on school lunches for a bunch of kids in New York City, I can increase human life expectancy by, instead of 2 years, by 500 years, right? And, you know, as far as I'm concerned, I'd rather have 500 good years than 2 bad years. What's interesting, of course, about this is that the Republican opposition is now basically kind of coalescing around the position that infinite amounts of care for those on the critical list and in the ICU is one of the American constitutional rights, right? Which this program will undercut. And in fact, that's the one good feature about the Obama-type programs, is you're trying to bleed out some of the subsidies that exist on the Medicare side of this situation by having a more rational end-of-life policy.
Wow. If there was ever a diversity of opinions at the Hoover Institute, this would be a perfect example of it. Do Gingrich and Epstein ever run into each other in the hallways and share thoughts? Next time on Campaign Watch 2012, President Obama's plan to close the federal budget deficit.
Campaign Watch 2012 with Ches Costanzo.